tutorial, we are going to be reviewing two types of key sutures today. The things that you're going to need to have ready would include just a little chucks work area. You want to have your skin pad, and as you can see, there are some linear incisions that we're going to practice suturing. You want your skin pickups, your hemostat, a small scissors, and then we are using the 3/0 silk braided with a curved blade. Typically, you would do all of your hand hygiene, you'd be wearing gloves, we would anesthetize the area with lidocaine. For today though, so that you can see a little bit better, I won't be wearing gloves, and we're not going to really talk about the lidocaine. Today our focus is really on the suturing. So what I'll have you do is go ahead and open up your demo sutures. I know this seems silly, but even at the top, you want to make sure you open them the right way. There's a little notch in the blue area. And when you open them, they should come out, and they are contained so that your needle is at the top and it's protected. So when you open your suture, you want to kind of go 2/3 back. You'll go ahead and pull out your thread. As you load your needle, I'm going to do that again for you, you'll kind of 2/3 back, and I'm right-handed, so when I look at it, I'm going to look like it's a rainbow going off to my right. As with any procedure, one of the most important things is proper technique. So I wanted to take a minute just to review the Thalnar Grasp. When we hold our hemostats with the suture and needle ready and loaded, we will use our thumb and third finger. When you use this, you don't want to go beyond that first knuckle, and you'll use your index finger to guide. If you go in really far, you're going to end up doing this kind of move. So just lightly hold, and you'll have your rainbow off to the right. As we approach, depending on how long the incision is, we're going to start somewhere in the middle. The first suture type that we're going to go through is the simple interrupted suture. If you start on one end and come down to the other, oftentimes you can have a little discrepancy in the skin or some puckering. So we start in the middle and then work to the edges. This is a great model to work on because it's a nice, well approximated, even without the suture, linear incision. As we approach it, we'll want to go, I'm just going to open it so you can see a little bit where the line is. You want to go about 5 millimeters lateral of the incision. As we think about going down, some of the key principles are that you want your input and where the needle comes out to be equidistant so that there's no pulling one to one side or the other. And as we move up and down, we would also like those to be really equidistant. The closer they are, the more scarring that you'll have. So what we'll go ahead, you have your hand in your correct position, about 5 millimeters lateral to the edge of the wound, and you kind of just make this twisting motion coming out on the other side, approximately 5 millimeters. You're going to release your hemostat. Use your hemostat to pull the needle all the way through, and you want to leave somewhat of a tail. This is what we're going to use to make our knot. So I'm going to go through this somewhat slowly. So you're going to continue to use your hemostat, and the idea is that we will make a square knot. So the first knot, you gently go around once, twice. And I'm going to talk to you about this briefly before I do it. When we make a square knot, we always go away and then back towards us, away, back towards us. You can also start the opposite, but you want that alternating pattern. So get a pattern that you will stick with. I always go forward first. So 1, 2. You're going to go ahead and grab the very tip of that tail. You don't want to grab it in the middle because it's really hard to pull through. So go ahead and grab the tip. You'll pull it through. With the one hand, I'm pushing away, and with the hemostat pulling towards me. Obviously, this isn't real skin, but it's a reasonable approximation. And so what you want to do is, when are you tight enough? You would like to pull it so that there is a slight eversion to the skin that will make sure that the tissue is pulled tight enough that you'll start to have wound healing, but not so tight that it's really strangled down. So just that slight eversion. You're going to release. And like I said, I started away from me. So this time I'll loop it, but I just have to go around once. Just twice that first time. Grab the tail, away. Opposite, so I threw that one away. Grab the tail, pull it through. And towards me, grab the tail, pull it through. And for a square knot, you'll want to do this 5 to 7 times. 5, 6, 7. A couple of things I want you to notice is one, that suture is really pretty equidistant to either side so that there's not tugging. That skin is a little bit approximated, and the knot itself is not directly above the wound. We put that off to the side. What we'll do now is you want to trim the tails. And again, that 5 millimeter is a great rule of thumb, just enough so when you remove it, you'll be able to have something to hold on to. I'm going to go ahead and snip that. And that will be one simple interrupted suture. I'm going to show you one more time, and this, I'll use my skin. So sometimes, depending on if this is, like I said, very beautiful and well approximated, but sometimes those pieces, think of maybe a dog bite, are jagged or hanging a little bit. You can use your skin pickup to gently grab the skin. You can push it through. You can use it on the other side as well, just as a little bit of a guide and to help. You're going to let go of your hemostat, grab, pull through so you have a tail left, drop your needle, 2 with that initial last loop, going to grab the tail, away, just until that skin is slightly everted, pull it back towards me, loop, away, towards me, away. Go ahead and take a little time to practice that. The second, if there's midwifery students, a suture that you often use in repairing tears or episiotomies would be this, the running suture. So in order to do that, we are going to reload in the same way. What's nice about the running suture is that you can just do a continuous suture line without breaking and having all these separate interrupted sutures, which is great for that type of tear. So again, with this one, we're going to start at one end and go to the other. I won't go all the way down, but we'll get you started. So very similar start. We're going to go in about 5 millimeters lateral, come out. You're going to let go, pull through again. You're going to tie off very much in the same manner that you did with your simple interrupted. So 2, you should be starting to get the hang of this. Grab the tail, back towards me. 3, 4, now, in order to do a running suture, we are not going to cut this. We're going to do a continuous suture. So I'm going to reload, and we're going to go right back in where this knot is, and on a 45-degree angle, come up adjacent to this. So we're going to be 5 millimeters down and 5 millimeters lateral to that incision. So we'll go right in where the knot is, 45-degree angle down, come out about 5 millimeters adjacent to the wound. Pull through. We're going to reload. And if you see right now, we're going to come in 5 millimeters adjacent on the right now, and we're going to angle down 45 degrees. Go in, angle 45 degrees down, 5 millimeters below where you came out before. We're going to go ahead and pull that through. And you can start to see we have these sutures marching down, kind of like train tracks down the incision. So go ahead and reload. Come in at 5 millimeters here, 45 degree down. We can keep doing that, the length. Go in, and this time I'll tie it off so you can see how you would tie this off. Some of you may also notice these hemostats are a little on the old side, so that one did pop open. We'll just reload. We're going to now knot it off for one last time. So we're going to come in here, and we're going to come back out where you went in. So you'll go in, out here, and this time we're going to leave the tail here, okay? And so it will be a little bit thicker because there's two, and you want to grab right at the top. So we'll go 1, 2, grab at the top, pull that right through, then towards me. Grab at the top. We treat it as just one away. Then you can go ahead and trim all 3 of these. This side now, and that is your continuous running. So I would encourage you to take some time now and go ahead and practice these different sutures.